When you think of receiving antibiotics through an IV, you may assume it needs to be done in a hospital. Well, here to tell us about outpatient intravenous antibiotic therapy is Joanne Ellis with Home Rehab Express and Dr. Dean Ratcliffe. Good morning. Welcome back again.
Good morning.
Thank you.
So remind people, Home Rehab Express, explain the benefits and again, why you're able to meet so many great doctors in the area.
Sure. Home Rehab Express is a Medicare certified home health company, and we are able to do IV infusions at home. So we work closely with Dr. Ratcliffe here on patients that are able to receive their IV antibiotics at home.
Yeah, so doctor, kind of explain, I know you've been here before,
Yeah.
we've always enjoyed talking with you. What an ID doctor, what kind of role you guys play? What are you doing?
Well, if the patient's been hospitalized for an infection and they're on IV antibiotics, we'll get involved sometimes if they're not doing well or if it's a very difficult to treat infection. In the outpatient setting, I really find a lot of opportunity to fill a niche there, and other infectious disease doctors as well, because the old mantra, the common teaching was, if you have an infection and it's failing oral antibiotics, that, oh, well, I have to put you in the hospital now. But really, that's kind of the past.
The old school thinking.
It's the old school, because now we have other options to avoid hospitalization, and we all know the risk of hospitalization.
That's just going to bring that up.
Right, you have hospital-acquired infections, patients lose sleep and dignity and all that, and the cost. So, so outpatient IV antibiotics is the trend now.
But you would need somebody, would you need an expert or someone from your team to help you do that at home? I mean, can you just... I'd imagine there's a little bit more care.
Well, I mean, the way it works is the patient typically sees their primary care physician and says, oh, Mrs. Jones, your infection isn't getting better with these oral antibiotics. You really need intravenous. I know of an infusion center I could send you to get IV antibiotics. Or what I would recommend is send them to an infectious disease physician, because they can better evaluate and manage the infection. Like our practice and others, you can do a same-day referral and get them on IV antibiotics right away and keep them out of the hospital. In some cases, they'll just get the first dose in our office, but then if they can't manage to come to the clinic, then we'll refer them to home health, like Joanne's agency, or if the infection's severe enough, we'll decide to put them in the hospital. So IV antibiotics should be given in a hospital, in an infusion center, at home, a doctor's office.
So there's a lot more options than maybe what used to be 10 years ago.
Right. Exactly.
So, okay. Well, very interesting. Doctor, thank you so much for being here again this morning. If someone wants to find out more, or Joanne certainly find out more about Home Rehab Express, what would you have them do?
I'd have them go to homerehabexpress.com or ask their doctor to refer them to Home Rehab Express for home health care.
Easy enough. Thank you both so much. We appreciate it.
Thanks, Carla.
And we, of course, will put more info on our website as well, fox4morningblend.com.
Up next, we go coconuts for this week's family favorite. How you can paint your own yard art with a fun activity for the whole family.